you for watching your video today. This is our CLC project. My name is Mariah.
My name is Andrea.
I'm Natalia.
And I'm Carly.
So for our client, they are working a 9-to-5 desk job, and their sport history is that they played some basketball in high school and college, and their medical history is that they had left knee surgery, a partial ACL tear in the left knee as well, and arthritis in the knee. And when you look at their PARQ, you can see that the only box they checked yes for was, do you know any other reason why you should not engage in physical activity? And this is due to all of the knee injuries. So our first analysis is going to be the static posture analysis. So here we can see that she has lower cross syndrome. So in the third picture, you can see that she's kind of at an angle and that her hips are rotated forward. And the common overactive muscles, some common overactive muscles are the hip flexor complex and the erector spinae. And underactive muscles would be the gluteus maximus and the transverse abdominis. And if it were a normal posture, she would be right in line with the lines that are drawn on the picture. And her shoulders also came in a little bit. So she would have her shoulders back and she would be upright and straight, and her hips would not be rotated forward. So this is the gait analysis. So in this video, we can see that our client has very rounded shoulders. Other than that, everything is pretty good. So the abnormality was she did have a rounded back, which causes her neck to protrude forward, and her overactive muscles are going to be her pectoralis, upper trapezius, her sternocleidomastoids. They're pushing her neck forward, and then underactive muscles would be her deep clavicular muscles and her rotator cuffs. So in a normal situation when someone is walking, they are usually going to be upright and their neck is going to be vertical with the rest of their spine. This can be due to the fact that our client is working a 9-to-5 desk job, so they're constantly leaned forward and looking at a device.
Next up, we have the overhead squat. It's an empty knee. As you can see, the knees, they're pointing out and they're not aligned straight with the feet, as the feet are also pointing out. And you can see the hands also coming down every time that the squat is performed. And then you can see the arch in the back as well within lateral view. And if you look closely, you can also see in the feet that they're still pointing out. And then lastly, in posterior view, you can also, if you look closely at the feet, you'll see that they start to lift up once the squat is performed, which is another abnormality. So the abnormalities pointed out in the video were the moving outward of the knee, excessive forward lean, and then the heel of the foot rising. Possible overactive muscles would be the pars formae, horrible with these names, the flexor fasciolaris, and then the gluteus maximus. Excessive forward lean and the rising heel have the same with the solar being possible overactive muscle, but forward lean also has the gastrocnemius, hip flexor complex, pisiformis, erector abdominis, Whereas possible underactive muscles for the outward lean would be the adductor complex, medial hamstring, and gluteus maximus. And then excessive forward lean and the right heel also have in common the adductor, anterior tibialis. And then what also is found in underactive muscles like the forward lean would be the gluteus maximus, erector spinae, intersect core stabilizers, which is basically your transverse abdominis, and then a couple more, which would be the pelvic floor muscles, which if you look here at our check weight, you can see what a normal one would be like. The toes would be straight forward, which would be aligned with your knees, whereas in my video it was not. They were both pointing out at an angle, whereas the lateral view, there's not as much of an arch or leaning in the hands, because in the video the hands kept going forward, whereas apparently she stayed straight aligned with her head. And then in the back, we also see that her heels are aligned with the back of her calves, whereas in the video of mine, they were right in the hands that faced the floor. The next one is the left test. Sorry. And then we're just going to show this one from a lateral view. The shoes one. As you can see, the jump was not done at an extreme or higher volume for the jump. I also put wearing shoes. You can't see if I was flat footed or not, but you can see it coming out. And if the video was playing with sound, so the abnormalities are around the shoulders and forward head lean, which also come from not bending the knees too much. So possible overactive muscles for the rounded shoulders would be the pectoralis and latissimus dorsi, whereas the forward head lean overactive muscles would be the trapezius, levitus, scapulae, and the sternal. I think it's so sorry, guys. Sternocleidomastoid. I pushed that. I'm so sorry, guys. Possible underactive muscles for head lean would be the middle and lower trapezius rotator cuffs. As you can see in the video, I was leaning over way too much, causing a round in the shoulders. Whereas for head lean, it would be the cervical flexors. So if you take a look here, we don't exactly have checkpoints that align with your body, but it's a normal stance, which means his knee, if you look closer in the picture, shows him at a level where everything is even enough to do his balance jump. Whereas in mine, I was bent more over, causing a higher lift up, making excessive noise when I landed. The jump also wasn't as high, with more of a forward facing line instead of his entire body being straight in line with one another. The land also wasn't as balanced as the one in this video. As you can see, he came back with his hands as he started. And his other jump actually went up, whereas in my video, I went out, which also caused an imbalance in the feet and head. Alright, for the same flex one, going over into the video, some normal findings should be that the lumbopelvic hip complex, also known as the LPHC, and the shoulder should remain leveled and face straight forward, and the knee should be tracking in line with the foot. So some compensations that you can see in the video, in the right leg, you can see a little bit of the knee moving inward and the torso moving inward also. The ones moving to the left leg, you can see it more clearly with that knee valgus moving inward and more of my torso going in, as you can see in the video right here. Some abnormalities or compensations
like I mentioned before, is that the knee moves inward, also known as the valgus, with the hip hikes or hip drops, and also looking at the torso rotates inwards or outwards. So referring back to the video, since you did see inwards with the valgus and the torso moving inward, it just shows some probable overactive muscles within the biceps femoris, the adductor complex, the TFL, the lateral gastrocnemius, and then some probable underactive muscles within the hamstring, the gluteus medius, and the renal gastrocnemius. And you can just see on like the lower right corner, the proper way to squat down. You can see how it's levels and how like the knee or the leg is just in line with the foot. And right next to the normal one, you can just see that torso moving inward and then like very baggy thighs on the right knee. So the knee nutritional assessment, which is an assessment that follows the measurement allocations on the base of support. So for this assessment, we can start out as which is to measure the individual's multi-player balance of the active leg or closed change functional movement, looking at the balance threshold, which is the distance one can squat down on one leg while completely aligned in the position. So as you see in the video, there's a little bit of the knee valgus in the left leg as I'm squatting down. This is before a compensation. As it continues, you will see also in the right leg that there is also some knee valgus with my shoulders forward and leaning forward as another compensation. And fast forward a little bit. So as you can see, you can still feel the knee valgus. So this is on the right side. And as I'm leaning to the side, you can see a knee valgus in that plane. So this is showing that I have an abnormality in the frontal and transverse plane because of the knee valgus. And this can be seen because of overactive muscles like the abductor complex, the bicep femoris, the TFL, and the vastus lataris. And underactive muscles would be the hamstrings, the gastrocnemius, gluteus medius, and gluteus maximus. And if you look at the picture chart right there, this is what the test should be looking like. Having my body in a neutral position as I'm squatting down, showing that my feet can stay in a line and not show any abnormalities like knee valgus. Dynamic posture analysis, which is looking at how an individual is able to maintain posture while performing a functional task. So the purpose of this test was to measure the upper extremities agility and stability. So on the first attempt, you can see I was only able to do 6 hand touches. And while you're looking at it, you can see I have a little bit of a low back rounded part in my attempt. In the second attempt, I was able to complete 8 touches. But if you like, you can see I decided to have a compensation in the ankle by having it turn inward. And by the third attempt, they're able to have 10 touches. But the low back round of my back was arching, showing that there was having a hard time trying to complete the task, showing the compensation in the back was greater. So back to the slide, the abnormalities found was a low back round, overactive muscles seen would be like the rectus abdominis, external obliques, and underactive muscles would be the intrinsic core stabilizers. So for the baby's test, there should be initial signs like completing the test being able to have it 36 inches apart while not having any abnormalities like a low background or a low back arch or having our feet turned inward. So looking at the chart, this is how the test should have been completed in a kneeling position. Here are the references.